How often do you have IV antibiotics and what impact does this have?
In the past 12 months I've had 5 admissions into hospital for IVs, one of which lasted 5 weeks.
But I need to go in once a year, maybe twice a year for IVs. And when I do, my entire life gets put on hold.
It takes a real toll on you, it's quite stressful and it's just emotionally draining.
And this has a huge impact both for childcare, both for the impact on the child who has to go into hospital because it's a distressing and stressful experience, and also for the child who has to stay at home, as that child doesn't get to see their mother or their sibling for 2 weeks.
It's not just the physical side, but it's also the emotional side. It is draining.
The impact it has on me is it massively affects your social life, especially if you plan things and then obviously you can't go, which is a bit of a pain.
What would having fewer chest infections mean to you?
They would be able to join in more with their friends and do more activities because they wouldn't be so poorly.
Going back to uni and pursuing my career within nursing.
It would mean less time in hospital, less time focusing on just health and medication and exercise. It would give me a chance to breathe and enjoy my life and just get on with things like a normal person without all these disruptions. It would really make a huge difference to have even one less chest infection a year.
Having fewer chest infections would mean that I could really start living my life. It would mean that I could go on trips, that I could get a steady job, that I could go to grad school and get an even better steady job.
What do you know about Orkambi?
Well, I know Orkambi is for the commoners, me, double delta F508.
I know that Orkambi is the new CF drug created by Vertex.
It's not a cure, but it is the first drug that, for my genotype, treats things at the root of the problem. It's not just treating the symptoms of CF like all of our antibiotics and existing drugs do. It treats CF itself and actually corrects the problems in the cells.
I know that in the clinical trials that it has had good positive results, although I understand it has not been quite as good as the results for Kalydeco. However, I understand that it has helped to reduce chest infections, that lung function results have gone up, and that has reduced the need for stays in hospital as well.
How would Orkambi make a difference to you?
With improvement in my lung function, my weight, because that's another issue. It'll hopefully allow me to spend more time out of hospital and more time socialising with friends.
It could keep me stable, it could stop my lung function from declining, and at this point that is really important and I really want that more than anything.
And hopefully it'll allow me to get back into university to do my nursing.
Orkambi would make a huge difference. It is what we've been waiting for since our daughter was diagnosed 5 years ago. Living with 2 children with CF is an extremely hard job and very stressful. I can't overstate how much hard work it is. And although looking after them has become part of the routine, and things like nebulizers and taking their Creon and giving them their regular medications like their antibiotics has just become part of our daily family routine, it doesn't get rid of the worry and the anxiety that constantly sits over you and makes even just everyday life harder than it needs to be.
But to help stave off the inevitable future, not many people have lived in life knowing that things like transplants are on their list. Things like permanent oxygen is on their list. One day being wheelchair bound is on their list. And a drug like Orkambi can help with staving off some of those inevitable futures.
What are your hopes and aspirations for the future?
I would like to finish my degree at university. I would like to have any kind of job and work to fund my own life and have independence and be able to look forward to a future and feel like that's a possibility.
that all of this structure and implementation and desire to enable CFers to lead what could be as normal a life as possible is achieved, and that we all get the chance to have those lives that so many people take for granted.
My hope would be that I could get healthy enough to be able to live my life without having to always second guess my abilities to live it. To be able to live without doubting that I can be strong enough to make it on my own.
It's about being able to make the choices that I want to make without having to worry about cystic fibrosis first. It's about young people with CF being able to go to school more, get the grades that they deserve, and be able to go to university in a way that I never could.